But I want to welcome you all here tonight to the annual meeting of the Academy of Cognitive Therapy. The primary purpose of tonight is the presentation of the Aaron T. Beck Award for enduring and significant contributions to the field of cognitive therapy to Michelle. Before we do that, I just wanted to get a sense of who all is here. How many of you, if you could raise your hand, are Academy diplomates or fellows? Oh, wow. Okay, good. And how many of you are members of the Academy but not diplomates? And how many are not connected to the Academy? I like to think of those as soon-to-be Academy members, so welcome to all of you. Before we get to the primary purpose, the presentation of the award, I wanted to describe, for those of you who are new to the Academy, the history and the purpose of what we do. And I wanted also to give special recognition to some people in the room. How many Academy current or former board members are here? Can you stand up momentarily and just introduce yourselves? Do you mind? Thanks.
Craske.
Thank you. Excellent. And how many former Aaron T. Beck Award winners are here tonight? Can you stand up and just introduce yourselves?
Terry Wilson from Bedford. Yeah, Rob Rubis.
And Dave Barlow from Boston.
Welcome to all of you. I wanted to introduce Troy Thompson, ex-executive director, in the back of the room. So the Academy of Cognitive Therapy is an organization whose purpose is to identify competence in cognitive therapy. It's the primary function of what we do is to evaluate CBT competence, and it's one of the few organizations that is multidisciplinary and international in scope that does that. The Academy was created in 1996 when 36 training directors got together to discuss the merits of establishing such an organization. And it was decided that it was the Academy, or the people that were there, were uniquely capable of assessing competence, and that it was a good idea to do that. It would be helpful to consumers when they were seeking out competent cognitive therapists, and it would be helpful to organizations that were making hiring decisions as well. We had a distinguished founding fellows that included Aaron Beck and Judy Beck and David Barlow, Bob Leahy, Marsha Linehan, Chris Podesky, Jackie Persons, and I think that the luminaries who really stood behind the organization speak to the purpose and the significance of what this organization does. In order to become a diplomate, we have a pretty thorough and comprehensive process that's primarily the demonstration of clinical competence through written work, which is a case history and a case formulation, and a audio recording of a treatment session. And the audio recording is blindly rated by the credential committee according to the cognitive therapy rating scale. And we use the cognitive therapy rating scale because it's a very good predictor of treatment outcome. And I think one of the nice things about the Academy, or one of the purposes really, was as CBT began to be disseminated, we really wanted to try to have some level of insurance that the kind of CBT that was being demonstrated to be effective in research studies was really what translated and disseminated out into the community. And so the, part of the accreditation process is really to ensure that. To date, we've got close to 1,000 people who have been credentialed, and I'm almost positive that in 2014 we'll surpass the 1,000 number. Up until a few years ago, we only had the capability of credentialing people in English, and as of today, we're capable of rating people who are monolingual in Arabic and Mandarin and Cantonese and Turkish and Portuguese and Spanish. And I'm sure in the next few years there's going to be dozens of different languages that will be added to that. We're also, the Academy's collaborating with a number of state and county mental health organizations to provide training and rating assessments. So increasingly organizations are interested in assessing the competence of the clinicians that are working for them and to ensure the quality of the services, and they're turning to the Academy for the competence that we have in assessing that. One of the things about the Academy that's always impressed me is the pride that people take in belonging, and the certification seems to have special meaning for people. It's a level of accomplishment, and it really is the professional home for a lot of people that are in the Academy, and it's represented really in the fact that we have year in and year out about 95% of our members and our diplomats renew their status in the Academy. So that being said, I want to proceed to the presentation of the 2013 Aaron T. Beck Award. It's presented each year to a person who's made significant and enduring contributions to the field of cognitive therapy. Previous award winners include David Barlow, G. Terrence Wilson, Rob DeRubis, Chris Podesky, Judith Beck, Paul Salkowskis, both David Clarks, Richard Heimberg, and Diane Chambliss, and Christopher Fairburn. So in preparing for this award presentation, I emailed David a week or two ago, and I asked if there was anything that was telling about Michelle's character or potential when she was a young graduate student that would have predicted the real remarkable career that she has had. So I wanted to read you what he wrote to me, because I think it's a wonderful email. So his reply was, I think it's enough to point out how far she's traveled at a young age, to fulfill her dreams that this award signifies. Growing up in Tasmania, the expectations were, as with everybody in Australia, that you're educated in your home state and preferably your hometown, and it doesn't occur to you to go elsewhere. Accordingly, she graduated from the University of Tasmania, but then, unlike most, she left friends and family to travel all the way to Vancouver to study with Jack Rockman, whom I don't think she ever met. And then, strictly on Jack's recommendation, she accepted a position with me at SUNY Albany without ever having met me in person. Funds being tight, she traveled by bus across the continent, which I don't think she did today, to reach her dream. She was willing to take a chance, and as characteristic of Michelle, she retained a deep sense of optimism that everything would work out. So I knew the CV was impressive, but I also had a sense that there were things that were off CV that would have been impressive as well. And to me, it's a remarkable story because it really points to Michelle's deep commitment at a young age and her pursuit of that dream despite having to break through expectations that may have held other people back. And the story reflects her willingness to take a chance and her trust that things would work out, and things have worked out, I would say, very well. And we in this room and the CBT community at large and our patients have all been the beneficiaries of Michelle's remarkable work. She's a professor of psychology and the vice chair of the Department of Psychology at UCLA, director of the Anxiety Disorder Research Center at UCLA. She's published extensively in the area of anxiety disorders, including over 350 scientific articles, 4 academic books, 19 clinical practice books. So I was trying to digest those numbers today, and it's numbers that we all would probably forget after we leave here, but I looked at the first article, and the first article was written in 1984, and I did a little calculation, and 350 over the course of 29 or 30 years turns out to be 11.6 articles per year. That's one a month, not counting the books and not counting the presentations and not counting the posters. It's a 60-page CV. So, but one article a month is really, to me, is the really telling statistic here. So on top of that, there's the 23 books. It's significant and enduring for our purposes tonight. And I would suspect that every one of us in this room, as I think I said, has been impacted by her work, as have our patients. So her work's been supported by NIMH since 1993 for research projects, looking at risk factors for anxiety disorders and depression with children and adolescents, the cognitive and physiological aspects of anxiety and panic attacks, neural mediators of behavioral treatments for anxiety disorders, fear extinction mechanisms of exposure therapy, and the development and dissemination of treatments for anxiety and related disorders. She's editorial board of the Journal of Experimental Psychopathology, wasn't for the Journal of Abnormal Psychology, and presently associate editor for Behavior Research and Therapy, as well as on the scientific board of the Anxiety and Depression Association of America. worked on the task force for anxiety with DSM-4 and DSM-5. Her contributions are extensive, enduring, and significant, and it's my pleasure to present the 2013 Aaron T. Beck Award to Michelle Craske. Congratulations. It's a beautiful.